Have you been trying to conceive for months, maybe even years, and wondering is it the right time to see a fertility specialist? Well, it's one of the hardest questions the couples face because hope and hesitation often walk hand in hand. In this video, we'll talk about the right time to seek professional help, what signs to look for, and how early intervention can make all the difference. Hi everyone, I'm Dr. Prathiba Govindaiah, and welcome back to my Fertility First educational series, where we talk about fertility, women's health, and hormones without the confusion or the stigma. If you're new here, make sure to subscribe and tap the bell icon so that you never miss our weekly videos. Let's start with understanding some basics. So, what is infertility? As we already know, infertility is when a couple hasn't been able to conceive after 12 months of regular under unprotected intercourse. But here's the thing. Not every couple should wait for a full year before getting evaluated. Depending on your age, health conditions, hormonal imbalances, or menstrual irregularities, it may be smarter to seek help earlier. If you are under 35, try naturally for a period of 12 months before consulting the fertility specialist. But if your periods are irregular, you've had surgeries in the past or previous pelvic infections, or there is a known history of hormonal issues, then don't wait too long. Early testing saves time. If you are over 35, the biological clock does play a role. Fertility usually declines significantly after 35 in women. So it's better to seek help, especially after 6 months of trying, as the quality and the quantity of the eggs decrease with age. So earlier intervention improves your options. If you are over 40, don't wait. Book an appointment right away. Even with healthy habits, egg quality and implantation rates drop sharply after 40. So getting professional guidance early is essential. Beyond age, there are certain specific medical signs that indicate it's time to see a fertility specialist. Irregular periods or absent periods. If your menstrual cycles are unpredictable, say shorter than 21 days or longer than 35, or you skip months, it could mean you're not ovulating regularly. Most common causes, as we all know, it is polycystic ovarian syndrome. Others are thyroid imbalances, stress-related hormonal disruptions, or extreme weight loss or weight gain. Next is, if you have been diagnosed with polycystic ovarian syndrome or other conditions like endometriosis, fibroids, pelvic inflammatory disease, it's important to get a fertility guidance early, as these conditions can affect the ovulation, egg quality, or even the fallopian tube health. If you have had previous history of miscarriages, especially 2 or more consecutive miscarriages, this is a strong reason to consult a fertility specialist. They'll check for hormonal issues, genetic factors, and uterine abnormalities, as well as other causes. Infertility isn't just a woman's issue. About 40% of the cases are linked to male factors like low sperm count, poor motility, or abnormal sperm morphology. If the conception hasn't happened after several months, it's important for both partners to be evaluated. If you have had a history of known medical conditions like diabetes, thyroid disorders, autoimmune diseases, these all can impact fertility, and if you're managing these, your doctor might suggest seeing a fertility specialist earlier than average. Painful periods or pelvic pain. Ongoing pain during menstruation, ovulation, or intercourse can be a sign of endometriosis or pelvic scarring, both of which may affect fertility. So earlier evaluation would be better. Previous history of pelvic surgeries or tubal surgeries. If you have had surgeries involving the ovaries, uterus, or fallopian tubes, there could be scar tissue that can affect the conception. A specialist can run imaging tests to evaluate this. Sometimes the decision isn't just medical, it's emotional. If you feel constant anxiety around your fertility journey, or the waiting is taking a toll on your mental health, it's okay to reach out for help. A fertility specialist not only offers medical solutions, but also clarity, and that peace of mind itself is powerful. What generally happens at the first consultation is that many couples hesitate because they fear what a fertility appointment might involve. But it's really just about getting information. At your first visit, the doctor will review your medical history, menstrual cycle history, as well as your past surgical history, and order a few basic hormone tests as well as a semen test. and suggest simple targeted steps before jumping into treatment. Remember, seeing a fertility specialist doesn't mean you have failed. It means you're taking charge of your journey. The sooner you identify what's going on, the sooner you can work towards your goal of becoming parents. If you found this helpful, hit that like button, share it with someone who needs to hear this, and subscribe for more honest conversations about fertility and women's health.